If some issue, I'll just share the new link. Just a minute, okay? Some issues. Just a minute, okay? Some issue occur. I just restart. Sorry. I don't know what's happening. 1 second, okay? Okay, I think it's back. Let's continue. Some glitch was there. Don't worry. It's okay now. I think everything is fine now. I think now it's okay, okay? I think everything is good. Okay, sorry. Good evening. Okay, now I am live. Okay, there was some issue. Don't worry, it got rectified. Chalo, so let's start. So yesterday we discussed 4 systems. Now we'll do the remaining system today. Let's do the respiration and the CVS today. So let's start. Yeah. Thank you for haircut compliment. Chalo. I'll update. Tomorrow is no optha. Tomorrow is physio TND. There's no optha. Yes, thank you, Sonu bhai. Yeah. Actually, I got time for haircut after a long time. So I got a new haircut. Please watch the class live. We are starting now. Please join in. Yeah. I don't know where my barber is from. Chalo. Manish bhai, please don't spam. Chalo, very good, okay. Okay, so I'm starting. Offline optha. No, tomorrow is no offline optha. Tomorrow is physio only. Chalo. Thank you. चलो. हाँ बिल्कुल आदि पुरुष इंस्पायर्ड हेयर कट, बिल्कुल वो रावण वाला. Endo will do in medicine, okay. There's a cut also. They made a cut. I said, why are you putting cut? They said, sir, cut is very good. मैंने कहा यार ऑलरेडी इतनी बार कट चुका है लाइफ में, तुम और कट लगा रहे हो. तो इतनी बार कटवा के मतलब बहुत छोटा हो गया लाइफ, तो और नहीं कटवाना, ठीक है, चलो आ जाओ. So let's continue and we'll rock. So today we are starting with, yes, the topic of, thank you doctor. Chalo, good evening, good evening. Yes, okay, I thought it's looking odd, but I think now it's fine, I don't mind. Okay, okay, so let's start the session and we will be learning with what? Yes, let's continue. Class timing, tomorrow timing will update, don't worry. Thank you, Hansraj bhai. I don't know what is looking like. Even if I was in college, I will still be, the same guy. So, let's start the respiratory system and we'll be discussing with the Weibel's airway classification. So, yes, thank you, Dr. Lakshmi. Okay. I never thought. I was just saying कि nowadays getting cut is a fashion, but already we have got cut so many times, okay, by so many people, then now it doesn't make sense to get more cut. Okay, so don't worry, pharma will be organized on 1st of July. We have posted the entire schedule, don't worry. Chalo, start. So trachea is our zero generation. Trachea is what generation? Zero generation. Then it give the bronchi, which is first generation. It give bronchiole. Terminal is called as generation 16. Respiratory start from generation 17. Then we have the alveolar ducts and the alveoli. Now acinus start from respiratory bronchiole. So what is acinus? It is from respiratory bronchiole onward. Okay. Now tomorrow will be both online offline. Don't worry. Okay. Now the exchange zone or the respiratory zone is generation 17 to 23, which is respiratory bronchiole and alveoli. This is called as acinus. Conduction zone or the conducting zone is no exchange. It is called as dead space. It is 150 ml. Okay, it's from trachea to terminal bronchiole. Terminal bronchiole, which is generation 16, is the guardian. It's like a gatekeeper. Yeah, I'll take the physio question discussion tomorrow. So it is having the highest smooth muscle. When it constrict, it is preventing the airflow, like in parasympathetic M3 or histamine H1 in asthma. And if there is a dilation, it is sympathetic beta 2. So sympathetic cause bronchodilation. So that is the bronchodilation. Okay. So okay, Kanishk, work is work. Let's work as much as possible. Now Boyle's law. So I made a mnemonic. It is a reverse relationship between pressure and the volume. It is called as Boyle's law. So when pressure increase, volume decrease. Like when you press something, the pressure increase, but size will decrease. So that's why relationship is between pressure volume, and here doctors are roaming single. देख रहे हो? तो मतलब किसके बीच में relationship है? Pressure volume, and doctors are in no relationship. Okay. And why they are not in relationship? Because doctors are above moh maya. They are above this things in the nature, like what? Life, relationship, love. They just want to do nirvana, help people, become like serve the humanity. Relationship, love, relation, all this thing they don't want. Okay, so yes, their only love is NBE and their exam. Okay, chalo. Respiratory movement first is inspiration. It's an active process. Why it's an active process? It uses the muscle. Which muscle? Diaphragm, which cause 75%, and our external, which cause the 25%. So what is external? IC's intercostal. So IC are intercostal muscles. Are you clear? Good evening to everyone. Thank you for your compliments. Yes, I will always take care of my health, because health is wealth. Okay, I do have wealth, but health is more precious than wealth. I don't want to lose my health or wealth, anything. Okay, clear? Now, what happens in inspiration? These muscles expand the thorax. So remember a mnemonic: external expand the thorax. So what expand? External expand. तो याद करना XX double X. Okay, so I don't know how many of you have double X, but if you are having double X, expand. तो जिसके दो X बहुत ही चौड़े में घूमता है, दो X, ठीक है. Next question is, as the size increase, pressure decrease, Boyle's law. This is Boyle's law, and what will it do? It will pull air in the lung. Are you clear? So pull air inside the lung. Now normal expiration is passive. There is no muscle. It is just elastic recoil which compress the lungs. So what is the compression? Elastic recoil. So are you clear? So there is only what phenomena? There is only the elastic recoil. Okay. And next question is forceful, like coughing, shouting. Okay. Shouting. So who shout more, girls or boys? Question for you. Girls or boys? Who shout more? Tell me. Girls or boys? What do you think? Girls shout more or boys shout more? They are saying girls shout more. Let's see. Okay. See, highly sexist people in my class, they think girls shout more. Okay. Why girls shout more? Why girls shout more? Because boys have hearing defect. Okay. Ab sahi hai? Now it's balanced. So that is why, yes, the girls have to shout. Clear? Like example, it said girls have twice the vocabulary of guys. That is, a girl know double the number of words than the boys. Boys only know double meaning things, but girls know more words. Girls know more words. Okay. So yes. So next question. Forceful expiration means coughing, shouting. So it's an active process. It use muscle. So what is active? Forceful expiration is active. Use muscle to compress thorax. It increase the pressure and push air out. Example, which muscle we use? Abdominal and internal intercostal. So remember, which muscles are for inspiration? External. What is for inspiration? External. What is for inspiration? External. Okay. See, I'm a teacher. I cannot be partial. Even if my gender is guy, I have to behave as if I'm gender neutral. That is why I never act like a guy. So I have the same guy-like feeling. Okay, understand? I am a male inside. I have testosterone, I have libido, but I have to keep it in control. Otherwise, it will not be good for any of us. Neither you people nor me. So that's why we have to keep it control. Like when you become doctors, you have to avoid having what things with patient. Like you cannot have a relationship with patient. It's not good. Okay, clear? So that's why two doctors were talking and he said, I am in relationship with my patient. Okay, is it good? Kehta, no, it's not good. Kehta, but other doctors are also having relation. Why my relationship with patient not good? Kehta, because you're animal doctor. You are a vet. So I don't know what kind of joke this is, but I hope you understood. So vet should not have relationship with their patients. Okay, so let's continue. Okay, so pressure inside the lung is called as intrapulmonary or intra-alveolar pressure. It is also called as IAP. It is same as atmosphere. Why? Because this lung IAP is same as atmosphere. Why? Because the airway connect the two, like this cup. Don't think this is having something else. It's just pure distilled water. Okay, it's not vodka as you think. So this is the case. Okay, I love you all. Okay, so this glass is the open cavity. So the pressure inside same as outside. The pressure is same as outside. Okay. Next question. So what is the IAP at rest? It is 0 or 760. Let me teach it here. Let me just close all my extra windows. Okay. So remember, this is the lung. This is called as IAP and it is same as outside, that is atmosphere. So this is our atmosphere. Okay. See, actually someone gifted me ki sir, you drink water in these glasses, then you will always be happy. I don't know why I'll be happy, because these glasses looks very fancy and I really enjoy drinking water from them. Okay, even guests come, we give them. Okay, only when my mother come to studio sometime we hide these glasses. I don't know why they hide these glasses when mother come. Maybe she doesn't like such heavy glasses. Okay, so atmosphere. Okay, Chal, let's continue. So pressure of atmosphere is 760 mmHg. Okay, and the IAP is also 760. Since they are same, we can write or 0 mmHg. Why 0? Same. Okay. Yeah, this RR will be available till the exam. Don't worry, just study. Okay, till YouTube is there, this video will be there. Okay, if YouTube shut down, I don't know. I can't take guarantee of YouTube. I can take guarantee of our video, but not this. Okay, bilkul. Mother is like this. Why you want to use fancy glasses? They're only for guest. So guest can drink in these glasses. We cannot drink. Highly partial parents. Discrimination started from house itself. Parents discriminate. And when mummy give money, 90% she take. So that's why parents teach us government scheme. Like government will cut the tax. Same way parents cut the tax. So that's why we learn about the TDS from the childhood itself. Okay. Okay. Yeah, I'll give this gift to everyone for enjoying. They can drink juices in this glass after the exam. I'll send everyone one of these glasses. Okay, clear? So you can all message me ki sir, we want your glasses. I'll send. Okay. Chalo. Now comes the question, what happens in inspiration? Inspiration, it decrease. So inspiration, it become -1 or 759 mmHg and pull air inside lung. It is 760. It is 760, not 60. 760 and pull air inside. And the expiration, it is +1 or 761 mmHg. 761. Okay. So it will be 761. 761. Okay. Chalo. Don't worry, we'll discuss everything. Just chill. Okay. Now comes the question. Lungs are surrounded by a negative charge pressure cavity called as pleural cavity. This is your pleural cavity. Okay, it is a closed cavity and it has negative pressure. Called as intrathoracic pressure. Called as so which pressure? Intrathoracic pressure. Okay. So what is the name given? Yes, it is called as the intrathoracic pressure or yes, intrapleural pressure, ITP, just say ITP. -2 mmHg. Now what is the negative pressure? It prevents the collapse of lung by pulling the lung outwards. What is the purpose? Negative ITP prevent lung collapse at rest. Are you clear? So that is the case. Hello bhai, hello Atif. Next question. Let's continue. So if there is a trauma to the chest wall, it can create a open pneumothorax. Open pneumothorax, the pleural cavity will become an open cavity, and we know the pressure in an open cavity is 0. And that causes the lung to collapse, called as pneumothorax. So this is called as pneumothorax. Look at this, I'll show a better x-ray. Okay. So what happens in case of tension, pneumothorax? The collapse occur. So can you see this diagram? So this is the air which has entered and the trachea has shifted to other side. Diaphragm is flat and this is the collapsed lung. This is called as our pneumothorax. So this is what condition? Pneumothorax. Are you clear? So what prevents the collapse of the lung? Answer is collapse of the lung is prevented by which factor, which funda? Yes. So it is our intrathoracic pressure. Very good. Now we'll discuss ITP. So ITP at rest is negative, -2. Why? To prevent collapse. Inspiration, it become more negative, that is more negative. So decrease ITP, more negative. Then in expiration, return to negative, and in forceful it become very negative, and in forceful it become positive. Clear? So what is the only condition it become positive is forceful expiration. Okay, forceful expiration. Okay, this is the summary. I told you IAP is 0. Why? It's an open cavity. What is ITP? Negative. Why? It prevent the collapse. Now compliance is stretching of the lung. Normal lungs are very stretchable. If they stretch and recoil, that is called as elastic. What is elastic means? Good compliance and good recoil is elastic. Okay. Now all lung diseases X, Y, Z causes decreased stretching power because there is a fibrosis, inflammation, infiltration like asbestosis, silicosis, pneumoconiosis. So all of these are what diseases? They are the diseases which causes decreased compliance, and decreased compliance is called as what? RLD. So what is RLD? Decreased compliance. Example, any lung disease which cause inflammation, fibrosis, they are all your RLDs, restrictive lung disease. Okay. Now the only disease in which there is actually a high compliance is emphysema, because in emphysema you don't lose there is no fibrosis, rather there is a loss of elastin, and this elastin loss causes poor recoil but high compliance. So lung become like a chewing gum, they can stretch and stretch and stretch, but what happens? They don't recoil back. So that's why compliance is increased. Compliance is increased in this case. Are you clear? Done? So let's continue. Okay, now let's start. Tomorrow is your test. Please give the test and then we'll discuss the paper. Okay. Now, so summary: compliance can be normal in healthy lungs, increase in emphysema, decrease in RLD. Okay. And if lung airway are narrow, it's called as obstructive lung disease. Example, COPD, asthma. Then compliance formula is delta V by delta P, where delta is the change. So the normal lung compliance 220 ml per centimeter H2O, 220 ml per centimeter H2O. So now if the compliance increase is what disease? It is emphysema. Decrease compliance is, yes, called as what? It is called as restrictive lung disease. Now there is a force in the alveoli which tend to cause the collapse called as surface tension. So it's an inward force. It try to collapse alveoli. What is it called as? Atalactasis. Also it can pull the water and that cause pulmonary edema. This edema is also called as hyaline membrane disease, HMD. And this both cause decreased compliance. This year NEET PG exam question. So NEET PG, there was a question asked ki what happens in RDS? Low compliance, high surface tension. That's why lungs are collapsed, edema is there, difficult breathing. So this is called as RDS, respiratory distress syndrome. So what syndrome? Respiratory distress syndrome. So are you clear? Next question. There is a decreased surface tension by our surfactant. So there is a decrease in the surface tension by our surfactant. It will prevent our RDS. So it prevents the RDS. Now comes the question, type 2 pneumocytes and the Clara cell. Okay, they make the surfactant. Okay, main is pneumocyte, type 2 pneumocyte. 70% are phospholipids and the main is DPPC, that is dipalmitoyl phosphatidylcholine. It is also called as lecithin. Okay, so it's DPPC. This was again the NEET PG exam question. So DPPC, okay. And what is DPPC? DPPC is lecithin. And lecithin is the main. So that is why that's, and what are the proteins? They are surfactant protein called as SP, A, B. B is the main. So who is the main protein? Yes, B is main. B is main. Okay. Now surfactant production start at what age? 18 to 20 week of the, yes, fetal life. Okay. So what are the age? 18 to 20 weeks. So first question, yes. When does surfactant secretion start in production? (18 to 20 weeks. So what are the ages? 18 to 20 weeks. What occurs? Surfactant production will occur or start. Done now? Next question. Okay. Next question. Next question is which life? Fetal life. And if I were to tell you all, fetal life is best life. After years of thinking, I have come to this conclusion, fetal life is the best life. Why? Number one, no tension of next NEET, no tension. Clear? Or PG. No tension of job, EMI, salary, house, income. No. No tension of sleeping, waking, alarm, snooze, traffic. No. No tension of changing DP. सबसे इरिटेटिंग काम है DP चेंज करो. You're not changing DP. You're changing DP. मर गया क्या? DP चेंज नहीं करा. DP अरे नहीं है टाइम. ठीक है. Then no tension of homework, school. No tension. Board, science, physics, chemistry, NEET, UG, PG. Then you don't even have to eat food. आज क्या खाऊं? दाल फिर से दाल. No. You don't even have to chew. Direct glucose. Boss, direct. Mother give you direct glucose. Then you don't even have to breathe. Inspiration, expiration. No. Direct oxygen from the mother. You get direct oxygen. Then you don't have to worry about where to stay. Hostel, PG, flat, own house, OYO. You have your own personal room with an inbuilt swimming pool. Boss, swimming pool. जितना मर्जी स्विमिंग करो. Plus no temperature, no tension of temperature. अरे AC कर बढ़ा दो, कम करो, hot, cold. You have automatic climate control, boss. Automatic climate control. 24/7 automatic climate control. Then you don't have to worry about Ola, Uber, transport. Where mother go, baby go. So that's why no tension of even transportation. Mother go, baby go, and you can play sport all day. More you kick, mother is happy. Wow, Ronaldo. Ronaldo is there. That's when the baby is born. The baby start to cry. Why? ये किस पाप की दुनिया में आ गए? अच्छी खासी जिंदगी चल रही थी. अब ये स्कूल जाना पड़ेगा, पढ़ाई करने. That's why the kid is crying. All the time they are crying. Okay. So that's why we should be thankful to our mother for the best 9 months. They are the best 9 months, better than 90 years after that. So that's why best days are which days? So best days are which days? So best days of life are our, yes, bilkul, they are your fetal. Okay. So we should be thankful to the mother, and yes, also thankful to papa also, because papa also played a role. ना, is not just the mother. पापा का भी रोल था, भले ही छोटा रोल हो, लेकिन रोल तो था ना. So that's why thankful to papa also. Okay. चल. Now second question. People are happy. Very good. Okay. Now secretion start at 28 week. So secretion is 28 weeks. Okay. Chalo. See, our classes are fun classes. Okay. So we are always, so that's why it is in amniotic fluid after 28, and baby can survive after 28 weeks. That's why it is called as the age of viability. So what is the age of viability? 28. So what is the age of viability? 28 is the age of viability. But maximum secretion occur at 34-35 weeks by steroids, who are the main cortisol. So that's why we can give dexamethasone for lung maturity in preterm labor. Okay, it's 28, not 24. Okay, Dr. Diablo, 28 is viability. In foreign country, it can be 24 also. They have advanced life care, so they can save baby even at 24. India is yes. Okay, yeah, DEXA 6/4 and the beta is 12. Very good. Okay, Abhishek. Chal. Next question, pulmonary function test. This is spirometry. Normal inspiration expiration volume is called as tidal volume, half liter, 0.5 liter or 500 ml. Maximum forceful inspiration is IRV, that is inspiratory reserve volume, that is 3 liter. Then what is maximum forceful expiration after normal expiration is ERV, that is the case. So let's discuss that. 1.3. So this is normal inspiration expiration. So let's discuss. This is TV. Clear? This is the case. So IRV is maximum inspiration, normal inspiration and normal expiration. So normal inspiration and normal expiration. Okay, this is maximum forceful expiration. Now after the ERV, the air which is not coming out is called as RV. So this is called as the RV. Okay, so the RV, it is air left in lung even after maximum forceful expirations. Once again, what is residual volume? It is air left in the lung even after maximum forceful expiration. Now since it won't come out, it prevents the collapse of the lung and also is not given by spirometry. Okay, now what is the sum of two or more volume called as capacity? Like IC is inspiratory capacity, which is TV plus IRV, normal is 3.5 to 4 liter. EC is TV plus ERV, normal is 1.8 to 2 liter. FRC is functional residual capacity. It is basically air left in lungs after normal expiration. After which expiration? Normal. Now we know that ERV doesn't come out in normal expiration. What comes out? TV. So that's why what are the air left in lung after forceful expiration? Let me give you a question and let's solve it. Make it like me. So after forceful expiration, and let me ask this question to you. Please answer my question. First, after forceful expiration, what comes out? Tell me. The ERV comes out. What's left in the lung? RV. Am I right now? Chalo. Next question to you. What comes out after forceful expiration? Tell me the answer. Sorry. Normal expiration. So what comes out after normal? So what comes after normal? No, not ERV. ERV is forceful. Normal में पढ़ाया था मैंने आपको देर पहले. What air comes out in normal expiration? TV. Tidal volume. ऐसे क्वेश्चन आएंगे एग्जाम में. Tidal volume. And what will be left in the lungs? Yes. ERV. ERV. Sorry. And RV. Called as FRC. Done now? So that is the summary. All of you understood? Okay. Now let's come back to the next topic. Okay. Spiro cannot give RV and FRC because RV will not come out. So that's why for FRC estimation, we use helium dilution method. So which method we use? Helium dilution method. Also single breath nitrogen washout, also called as Fowler's method. It give you dead space also. Then plethysmography is used in the old age. So let's revise. How do you measure FRC? Yeah, FRC. This is FRC, na? So after normal, FRC. Yes, you are right. It's FRC. Okay. FRC is left in the lungs. Okay. Let's continue. What is vital capacity? It's maximum inspiration followed by maximum expiration. Okay. Maximum expiration. Done. So maximum inspiration, maximum expiration. Let me show you now. Okay. Have a look. See. So this is the case. So this is the case. This is IRV. RV will not come out. Yeah, plethysmography is used in obstructive lung disease. Okay. RV won't come out. This is your VC. Are you clear? So what is VC made up of? So VC is made up of three values: IRV, okay. Yeah, chalo. So what is the normal value? Normal VC, males 4.8, females is 3.2. Now not old age, okay, it's OLD. Okay. Now next question. In RLD, VC will decrease because of poor compliance, but in OLD, VC can be normal or it can be decreased. Okay, so let me just discuss that here. So right, decrease VC in RLD because the lungs are not stretchable. TLC I will discuss soon, na? Don't worry. So it is, yes, decrease VC in RLD and can be normal or decrease VC in OLD as lungs are okay but only airway are obstructed. So what can be there? It could be a normal or decrease VC, normal or decrease in the VC. Are you clear? So normal or decrease VC. Yeah, male is 4.8, female is 3.2. Okay. So that is why, so it could be normal. So we use dynamic volume and capacities in OLD diagnosis. So for OLD diagnosis, what do we use? So we use the dynamic. Example, TVC or FVC. What is TVC? Timed or forced, yes, vital capacity. Yeah, it can increase in OLD, na VC. I told you, but it is not increase, it is decrease. Okay, Ranita? Okay, now understand, we make three parts. FeV1, FeV2, FeV3. Okay. Now first question, what is Fe1? In first second. So it is force expiratory volume in first second. Example, let's say TVC is 5 liter. In first second, how much comes out? That is FeV1. Let's say 4 liter. So in percentage term, it is FeV1 by into 100 into 100. Okay, so that will give you F in percentage. Normally it is 80% of TVC. Now if there is a airway narrowing, air will come slow, so it will be less than 80%. So remember, best investigation to differentiate RLD from OLD is FeV1 percentage. So what is the value? FeV1 percentage. Now let's see. First, if it is decrease, that is less than 80%, it is OLD. And if it is normal, that is more than 80% or equal, this is could be normal. So we record VC. Now what are the two possibilities? Two possibilities are either it will be normal or decrease. If decrease, it is normal. So if it is decrease, it is RLD. If normal, is healthy. Yes. So this is how you operate or check. Done? So all of you understood and convinced and clear? Let's continue. Now let's discuss again. This is all discuss. So what is the best investigation? FeV1 percentage. So what is the best? Fe. If it is the case. Now comes TLC. TLC is total lung capacity. It is sum of all four volume. What is the sum of all four volume? It is IRV, ERV, TV, RV. It's called as what? TLC. Spiro failed to give RV, FRC, TLC. So what does that fail to give? It failed to give all these values. Are you clear? So what failed to give all these values? Answer is, it is our yes, RV, FRC, TLC. Now let me do a discussion, revision. Let's see that revision summary. So make this diagram. Now let's have a look. So first, okay, So this is TV. This is IRV and this is ERV. This is IC and these two combined are called as VC. Are you clear? Now what ear will not come out? RV. So these two combined is FRC and sum of all is TLC. Is TLC. Fine. So my question is, can we write TLC like this also? IC plus FRC is TLC. Yes. Okay. So that is TLC. So that means we can write it as IC plus FRC or VC plus RV. VC plus RV. So VC plus RV. Okay. Done. So in the exam, this question was asked in NEET PG. This was your NEET PG. I'm doing PYQ. 2023. They asked, what is this value? What is this value? Tell me the name. Tell me. Tell me. Yes, FRC. So easy question. Okay. Now in the exam, yes, from Nepal kya baat hai? Hello bhai, how is Nepal doing? After a long time seeing someone from Nepal in the class. Otherwise only students from India, maybe from Bishkek, Kyrgyzstan, Philippines, all are watching, but long time. So this is the exam question. Now in the exam they don't give you pen. So what you do is, if they don't give you paper pen, you can use very simple method. You can use, this is TV, IRV, ERV, RV, FRC, IC, VC, TLC. So if they don't give you paper pen in the exam, how do you solve this question? Very simple. What we do is use the hand method. So use your own hand to calculate the values. So take your hand and please don't show it to the examiner. Otherwise the examiner might throw you out. So just use the finger method. So just take these fingers and count them. This is IRV in IRV. ये in है in IRV I. This is TV. I am not joking. It's a serious method. I know you might think it's vulgar. It is not vulgar. अरे वाह क्या बात है. चलो, thank you very much. I hope Rabi one day we come to Nepal also. I'll be very happy to take session there. I used to come there to take classes in Bhatia Institute. Okay, we have in Chabil, you know, that Radha Krishna, Gopi Krishna Cinema Theatre, petrol pump. There we had these classes. So I used to come every year for classes there. It was a very nice experience. Very sincere students were there. But again, because of COVID, all shut down. And this is RB. This is your RB. Love from Gautam Nagar. Are Gautam Nagar. So you can see me daily in Gautam Nagar because I am here for classes and coming. So Gautam Nagar. In fact, I am in Gautam Nagar now. Okay. So love you all from Gautam Nagar. So this is your finger method. So this is our finger method. Done. Okay. Don't show to examiner. Okay. Now we'll discuss the ventilation. Ventilation first is pulmonary ventilation, which is air going in and out of lungs in 1 minute. How do you calculate? 12 to 16 TV into RR. What is RR? RR is 12 to 16 is RR. So RR is 12 to 16. So that give you 5 ml in one breath. 12 is giving you 6000 ml or 6 liter per minute. So this is your value. क्या बात है? Love from home. Yes, very good. You all are lucky if you are in home, because home is very great place. I don't get time to go home because of extreme busy schedule, but I hope one day I will, yes, take regular classes from home only, but again not possible. Chalo. AV is air getting exchanged per minute in the lungs. Okay. Now what is AV formula? It is TV minus DS. What is DS? Is dead space. What is dead space? Is the air not getting exchanged in the airway or alveoli. It is called as the dead space. It is called as the dead space. Okay. If airway, anatomical. If alveoli, it is called as alveolar dead space. Okay. So airways is anatomical, alveolar is alveoli. It is 0 and airways is 150. This is called as anatomical dead space. Physiological is anatomical plus alveolar dead space, which is 0. So that's why they come equal. Okay. They are equal. Okay. Yes, we'll show. Naughty Nazma, don't say this. It's not a good thing. If you give it to NB, they might give you something else rather than passing certificate. Okay. They might give you something else. Very, very dangerous condition. Okay. So next question. What is the value of alveolar ventilation? It is tidal volume minus dead space. That is 350 into 12. That is around 4.2 liter per minute. So how much is AV? 4.2 liter per minute is our alveolar ventilation. Now comes the very important ventilation perfusion ratio. It indicates the gas exchange. Indicate the gas. What is the ideal ratio? 1 is the ideal ratio. 1. Remember, let's say in a, let's say college or any city or village, if there are 100 boys and 10 girls, what is the ratio? 10:1. It's a good or bad ratio? Very bad. There would be fights all the time, like in China. In China, there are less girls, more boys. So that's why they are having issue. And it is said that around 50 million Chinese males will not get any partner. 50 million, 5 crore will spend all their life single. देख रहे हो कितना बड़ा अत्याचार है. So that is why, what is the ideal ratio? 1:1 is the ideal ratio. So when I was in MBBS, I had this ratio. So in our MBBS, there were equal number of boys and girls. So we had ideal distribution, gender distribution. Okay. Don't feel sad. India also same situation will occur. That's why, yes, we need to do, yes, बेटी बचाओ, बेटी पढ़ाओ, और फिर बेटी को स्कूटी दिलाओ और बेटी को बोलो कि स्कूल जाओ और पढ़ाई करो. ठीक है. सो बेटी बचाओ, बेटी पढ़ाओ, बेटी को स्कूल भिजवाओ. चलो. Okay. Next question. If VQ is not equal to 1, that means the air is not getting exchanged. This is called as VQ mismatch. And VQ mismatch cause poor exchange. Poor exchange cause which hypoxia? Hypoxia. Hypoxia basically tissue doesn't get oxygen because of what? Lungs. So let me explain now. So understand. So first, what is hypoxia? Lungs fail to oxygenate, yes, ठीक है, the blood. So lungs fail to oxygenate the blood. Okay. So example causes VQ mismatch. In fact, VQ mismatch is the most common cause. Then lung diseases. So lung diseases. What else apart from lung diseases? Also, see, dead space is the air not getting exchange. Okay, VIP. So that is the air which is not getting exchange in the airway, called as anatomical. If alveoli, called as alveolar dead space. Total is called as physiological dead space. Now, VQ mismatch, most common cause. Then other causes. High altitude. What can we do to prevent high altitude sickness? How can you prevent high altitude sickness? Very simple. Don't go. Then lung diseases. So what diseases? Lung diseases. Love you 3000 भाई. ये कौन सा नाम है? We can't even read. Malitz. M says Malitz. चलो, very complex name भाई. चलो, high altitude. Yes. Then also, अरे don't go ना. Most people go there what? For sightseeing. Better see the video or do a Photoshop, put a green screen behind. Clear? Russian नाम तो नहीं है भाई. I've been to Russia. I have in and out information knowledge of Russia. So it's not a Russian name, okay? If Russian name, mostly they are Alexander or they are Dimitri. They are the most common name. ठीक है? Vladimir, Alexander, Alex. ठीक है? If girls, they are all Ras, okay? Their name and in Ras. In fact, all the girl name there, they can be categorized into 10 different names, okay? Like, it'll be Alexandra, which can be Alexa, then Shasha, Masha, Dasha. And I think 2-4 और नाम होंगे, याना, यानोचका. बस these are 10 names there. इसी में सारा रशिया निपट जाता है. ठीक है, चल. हाँ, वही नतालिया, नताशा. ठीक है, वही तो कह रहा हूँ, 10 नेम. Medina is less common there. Medina is more common in Kyrgyzstan, Kazakhstan, Tajikistan. Okay. This surname, okay. Actually, they get surname Ovas. Ova, Ova. And guys are Ovs. Okay. Clear? Yeah, I am knowledgeable ना. I have, yes. अपने यहाँ तो दूसरी वाली आ होती है आशा, और आशा फैलाती है निराशा. Yeah, we can give acetazolamide. Okay. ठीक है. So आशा. Yazına yuparuski, okay? Потому что был много раз, и у меня был гости, много друг, подруги, много был, okay? So, experience, okay? Chal, let's continue. चल, let's continue. कोई बात नहीं भाई, अपने लिए सब सेम है. ठीक है. Now let's continue. Other causes. Yes, there is. Yes, right heart diseases. Now what is the hallmark? Hallmark is decrease PaO2 less than 60 mmHg. It's not something wrong. It's something very right that I run Russian. Okay. And yes, I got very good motivation to learn Russian. Okay, I had a very good Russian teacher. She was also pathology teacher. So she used to teach pathology in the daytime. Night she used to teach me Russian. I used to teach her other things. So we taught each other. So it's a very good learning experience. Okay, and I learned a lot from her. In fact, things I never knew they exist. They told me. Okay, so that is the case. Okay, so I'm very happy. I know this. Okay, almost all countries I've been. Almost all. Okay. Except Philippines. I've not been to Philippines. I don't know why, but I've never been. So decrease, also decrease SpO2 less than 94, and there is central cyanosis. Central. So what are the cyanoses here? It is central. Yeah. Central cyanosis. Okay. Let's move next. Other hypoxias, PaO2 is normal. So all other hypoxias, okay, PaO2 is normal. Okay. Chalo. Let's continue. So PaO2 is normal. Now comes the question. So this is normal PaO2. Okay. What are the others? Anemic, decrease hemoglobin, no cyanosis. What is stagnant? Poor blood flow. And there is peripheral cyanosis. पेरिफेरल साइनस. ओके, चलो अरे एंजॉय करो, यही तो हमारी लाइफ है. ओके, देन हिस्टोक्सिल. व्हाट हैपेंस हियर? टिश्यू फेल टू यूज ऑक्सीजन, fail to use oxygen despite normal blood oxygen. So once again, tissue fail to use oxygen despite normal blood oxygen. चलो, most welcome भाई, enjoy the class, keep learning, that's what our motto is. Example, so again no cyanosis. Example is cyanide poisoning. Last to last year exam question, what does cyanide do? It inhibit complex 4. Again very important exam question. Inhibit complex 4 of electron transport chain. So it is ETC. What is ETC? Electron transport chain is ETC. Done now? Yes, brick red color, very good. Let's come back. If VQ is more than 1, it is called as high VQ mismatch, and air is left unexchanged, so that's why it increases the dead space, physiological dead space. Example, pulmonary embolism and emphysema. Okay, so what is high VQ means? Air is more, blood is less, so air is not exchanged. Example, embolism, emphysema. Okay, now what is the VQ of the entire lung? So VQ of entire lung is 0.8 from apex to the base all, but highest is at the apex. Let me write everything, copy here. This is a lung. This is the apex. Base VQ is 0.6. Base VQ is 0.6. Yes. Now it is maximum at apex due to minimum perfusion, and because of high VQ, maximum tuberculosis here. So why TB occur in apex? Because it has more oxygen. So because of high VQ, maximum TB. Base has minimum VQ due to maximum perfusion because of gravity. So it is because of gravity. Okay, and there is highest ventilation, it is also base. At base, so maximum ventilation is at the back. Okay, so where is highest? Okay, Pranam bhai, Abhimanyu. So where is highest ventilation? Base. Highest perfusion? Base. Highest perfusion? Base. Highest VQ? Apex. Why? Less perfusion. So ratio become very high, 1.3, 1.6. So that is why tuberculosis occur max where? In the apical lobe. Thank you bhai, thank you for all your compliments. I am working my level best to help you all so that you all can get very good score and very good rank in the exam. So that's why idea is get you all clear the exam without any issue or without any funda. Okay, so my target is help you all, and that is what I am doing since the beginning. So when I started my career, I came to Gautam Nagar. I saw lots of FMGs and they really paid me so much respect. They used to make food for me, so I really fell in love with them, and I decided I will never ever leave them and I will always help them. So that's why I am helping them since 2008 when I first started teaching the FMG 15 years back. So I'm teaching for 15 years FMGs. So some of you are not even, not born, you were born, but you were in school. So you were in school that time I am teaching, okay? So I have ample experience, okay? Chalo. Now I'll discuss the partial pressures. So in partial pressure, just remember the important value which I'll tell you. Just give me a minute, I'll get my water and come, okay? 1 minute. 1 minute, not break, just 1 minute. I'll get water. This is not, no, this is water, but I cannot drink, it's very cold water. Let me get the fridge, okay? Ventilation is highest at the base. Chalo, I hope we start Monday classes in Chennai. I need your support because that is the case. Chalo, thank you very much. Abhimanyu, you are here and there both. Chalo, very good. Yeah, NEET PG will do very soon. Already I made a group. No. Highest. Both are maximum at the base. There must be misconception. Yes, there is highest perfusion and highest ventilation. Both are base. So I don't. Yeah, we'll do NEET PG very soon. That is my promise. Okay, so start, continue. So write once again, write down. First question, maximum ventilation and maximum perfusion at base. ठीक है, चल. Yeah, yes, you are right, Sonu. There is more ventilation there. Now is writing partial pressures. So write partial pressures. That is PPs. Only write the important values. First is PaO2. That is the alveolar oxygen. It is how much? So alveolar PO2 is how much? It is around 100 mmHg. Chalo. PaO2 is arterial. It is 95 to 98 mmHg. PbO2 is venous oxygen. It is then come PaO2. PaO2 is arterial. Sorry, PaCO2 is 40 mmHg. Yeah, for base, highest perfusion and highest ventilation is there. It's very big, surface area, more alveoli, so more ventilation is there. Okay, so let's continue. Gas exchange occur by simple passive diffusion, and it follow which law? It follow the Fick's law. So it follows the Fick's law. Now, what does the rate of diffusion depends on? It depends on gas. What? The size of the gas and the lipid solubility. More the solubility, faster the gas will go. Example, CO2 is more lipid soluble, so it go very fast. What is the fast gas? CO2 is a fast gas. Then come partial pressure. More you give the pressure, more the gas will diffuse. Like if I fill this glass with more water and make a hole, more water will come. That is called as partial pressure. When you give oxygen therapy, it causes an increase in the PO2. As we increase the PO2, it will lead to what? Increase in the oxygen diffusion, and that will increase the PO2 and correct the hypoxia. Are you clear? Then third factor is respiratory membrane. The normal area is 70 meters square and normal thickness is 0.5 micron meter. 0.5 micron meter. Now, decrease area or increase thickness like in what disease? Like in ARDS, ILD, emphysema, pneumonia, emphysema. It causes poor diffusion. They are called as membrane or diffusion disorder. What is the name given? Membrane or diffusion disorder. Okay. Now, what is the investigation of choice for membrane disorder? It is carbon monoxide. Which gas we use? Carbon monoxide. What is the name? It's called as diffusion capacity in the lung for carbon monoxide, also called as DLCO. Now, in CO2 transport, just remember one question they ask you: what is the main transport form of CO2? It is bicarbonate. It is bicarbonate. Now, oxygen is what? Carried by blood, 250 ml per minute or 5 ml per cent. 99% of the oxygen is carried by hemoglobin. So it is 99%. And dissolve is just 1%. It's just 1%. And hemoglobin is like a taxi. So question for you, okay? Question is, how many people can sit in one taxi? How many people can sit in a true taxi? 4 passengers. Okay? And in fake taxi, how many can sit? Any number, 1 or any number, 1 or any number. But in a true taxi, 4. True taxi, 4 passengers can sit. Okay? And auto, rickshaw, infinity. So infinity is the answer for yes. Yes, auto. So slide to ye meri. Okay, Ranita? I'm just writing it here. Most welcome. Okay. Yes. We are trying to help every student as we are doing from the beginning. And we just need a small help from you people also. If possible, do ask your juniors to consider not the famous, big or more marketing name. Okay, I know they have more money, and because of money you can see their ads. So they are running ads everywhere. They are paying money to the students to act as their ambassador, marketer. So वही जैसे वो ऐप बिकती है ना कि buy my, use my account. So they have a very big team. They have big team of people selling their products, selling their coachings. We don't have anyone. Okay, we have just me and team member. Okay, so we don't have money to market for NLC. Okay, so that's why I just request you, if possible, do ask your juniors and friends to give a chance to attend some demo in the NLC. I'm not saying ask them to join NLC, but at least they can do it was 40 mmHg. Okay, thank you bhai VIP. तेरे मुंह में घी शक्कर, chocolate, chocolava cake or whatever you want. So remember PaO2, PaCO2 is 40. Okay Amrita, thank you Heba. ठीक है, इंशाल्लाह एवरीथिंग विल बी गुड. माय बेस्ट विशेस टू यू. ओके, देखो जिनके हार्ट साफ हैं, जिनके मन में कुछ भी नहीं है, उनको हमेशा हेल्प मिलती है, चाहे वो किसी भी फॉर्म में आए. सही है. सो आई विश ऑल ऑफ यू आर एबल टू. Piyush, don't worry, we will surely do all this. Okay, so please ask them to consider NLC as a option for coaching. Okay, हो क्या रहा है, वही बात हो रही है कि people are ignoring, like a good institute just because they see only fancy. तो वही बात है, fancy, famous, popular are sold, and those who are not famous, they are not sold. Okay, so that is the thing. It's like, ignoring good people just because they are not wearing very fancy dress, and you just attract to people who are wearing fancy iPhone 14 है और Gucci Armani है. तो we are like very simple people, so that is the problem. Okay, so I hope. Thank you Dr. Salim. Continue. So your help, see, those who help good people, they get good in the end. So if you help us, you will get good in the end. That is my promise. Okay, so 1 hemoglobin carry 4 oxygen, 1 hemoglobin 4, and 1 gram carry 1.33 ml. Okay, now PaO2 depend only on the dissolved gas, not on hemoglobin. This is called as Henry's law. This is called as a Henry's law. Thank you. Chalo. So let's discuss the most important thing, that is oxygen hemoglobin curve. First, it is sigmoidal. It is sigmoidal or S shape, like this, and myoglobin is hyperbola. Hyperbola, like this. So myoglobin, and what it does, it store oxygen in muscle, in red muscle fiber. And 1 myoglobin, 1 MB bind 1, so 1 MB bind 1 oxygen. I'm making both the curves. Let's see. So I hope the results come good. This is hemoglobin. This is myoglobin. Fine. So it is hemoglobin, it is myoglobin. Done. Next is, right, there are 2 shifts. The right shift release oxygen to tissue. This is Bohr effect due to high CO2. So it is high CO2, and this is our left shift. It is in lungs, increase oxygen affinity. So hemoglobin bind oxygen. So hemoglobin will bind oxygen, and this is called as Haldane effect. So how to remember? Haldane effect. So this is called as, just follow this diagram, okay? Don't follow anything else, Ramya. This is what I'm telling you, right shift and left shift. So this is right shift, this is right shift, blue one, this is left shift, the green one, okay? Now remember the mnemonic. Right, release, bohar, ra ra ra. So ra ra ra, ra 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 ra, ra ra ra. And what is la la la? Left lungs Haldane. So remember, Haldane is left, Haldane is left, left is in lung. La 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 la, and ra 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 ra, ra 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 ra. So this is ra 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 ra. So are you clear? Done? Chalo, let's start next. What are the factors causing right shift? Yes, in the perfect summary. Right shift, left shift. So obviously, right shift is when there is less increased CO2 and decreased PO2. That is hypoxia, exercise, high altitude, then acidosis, increase H plus, lactic acid, increased temperature, and also increased 2,3 BPG, also called as DPG. DPG. Yeah. So decrease pH is right shift. Now what BPG do? Bind beta chain and cause oxygen release. So bind the beta chain of hemoglobin A and cause oxygen release. Okay. Reverse. Decrease PCO2, increase PO2, alkalosis. Yes. Decrease 2,3 BPG, decrease temperature. So decrease what? Temperature. Decrease temperature. Okay. And also there is what? Yes, fetal hemoglobin, HbF. So HbF has no beta chain, no 2,3 BPG binding. So if it doesn't have BPG binding, yeah, pH is increase. Okay. Yes. And it has, so HbF has higher oxygen affinity and extract oxygen from fetal and it will extract the oxygen from fetal hemoglobin, from maternal hemoglobin. Okay, so please remember them, they are very, very important. And one more thing, CO make COHB which is carboxyhemoglobin. It is cherry red. It's an abnormal hemoglobin. Won't release oxygen. So it won't release the oxygen, and as it won't release oxygen, it causes death. And it is anemic hypoxia. So this was the exam question. What is it? Answer is, it is anemic hypoxia. In the exam, if they ask you it is which hypoxia, my request is it is our anemic hypoxia. Let me now teach you. So right shift, left shift, we have discussed that. That is the shift. Now remember, we have discussed that CO poisoning. So CO has 210 times more affinity for hemoglobin than oxygen. It makes carboxyhemoglobin, which is cherry red. Most common cause is sleeping with fire in the closed room. Okay, and it causes CO poisoning. It's an abnormal hemoglobin. It won't release oxygen, so death occur. That is anemic hypoxia. Anemic hypoxia. Okay. It's okay, so Ketu, understand. Okay, I'll tell you a very simple rule. Okay, not every person will do what is right, or maybe their right is right from their point of view. Clear? Like, why so few people are successful? Why the result is 10-20%? The reason is very simple. Very few people are actually able to follow everything perfectly. Like, study properly, okay, make efforts, be a good student, be a good doctor. So that is why the problems occur. If everyone were to do this, then India will be the most developed country in the world. If every Indian do everything properly, like they study very well, they follow the rules, pay the taxes, government is honest, because people make the government. So that's why my simple explanation is very simple. It is people will do what they feel is right. Okay, so maybe for them there are multiple reasons. So I have now stopped giving any kind of reasons why people are not attending. Okay, so if they are not willing to watch the free sessions, imagine what they will do with paid ones. They've all purchased the apps, but no one is actually watching these apps. The truth is, very few watch, and even they watch some 5-10 minutes, then they stop, then again watch, then they read some note, do some MCQ, random stuff. That's what I'm telling you, the results will never improve. They will never become very high, 50-60%. Even 80% is impossible, because people are not sincere. Okay, Piyush, we are doing as much as possible. Don't worry, we will conduct PYQs, will conduct test, everything. Okay, our work is to teach. So I've just given up. I've given up regarding motivating people to study, come to class. मेरा simple था भाई, मैं पढ़ा रहा हूँ. If you want to study, come study. If you don't want to study, it's your life. You will regret. You will face it when you don't pass. I have seen people not passing for 10 years and they keep abusing NB. भाई आप effort डालो ना, sincere, honest effort डालो, and then mostly you will pass. Okay, luck only play 1% role. 99% is your hard work. Now, who's the pacemaker of respiration? Yes, it is your medulla, which contain pre-Botzinger complex, or the DRG, which causes the inspiratory muscle, mainly inspiratory, and causes automatic involuntary respiration. And this is causing the respiration even in sleep. Problem, but it is irregular and shallow. Irregular and shallow. That's why Pons make the respiration regular, smooth, and good volume. So what is the purpose? It make it regular, good. So that is why. Okay, and what is the center here? So Pons has apneustic center, which basically make it deeper. So देखो, increase depth by increased depth of inspiration by apneustic center. Okay, so apneustic center increase the depth. So if there is a medulla lesion, respiration stop, that is called as apnea. It's called as apnea. If Pons's lesion, irregular, shallow breathing. If mid-pontine lesion and vagotomy is done, then there is a apneusis. What is apneusis? It is respiration stop in inspiration. That is called as apneusis. It looks like this. So respiration stop. So what is apneusis? Stopping of the respiration in this. Okay, fine. And pneumotaxic center prevent apneusis and increase the rate. I'll write it here. Pneumotaxic center. It prevent apneusis and increase rate of respiration. So what is for rate? Pneumotaxic. What is for depth? Apneustic center. Apneustic center. Are you clear? Yeah, I will share the PDF in the end. Don't worry. So that is the story here. Okay. Now, next question. Who regulate the respiration? It is by chemoreceptor. What do chemoreceptor do? They basically sense and correct the hypoxia. So what they do? Sense and correct hypoxia. What they also will do? They are basically stimulating respiratory centers. Okay, they cause hyperventilation like this. As you breathe more, there's more tidal volume, more RR, and that will correct our respiration. That will correct our respiration. Now, there are two types of chemoreceptors, central and peripheral. Central are present in the ventral medulla and they are only stimulated by H plus in the CSF. Whereas peripheral are in blood and they are stimulated by, yes, by blood changes. So their blood changes. Okay, or the blood changes, H plus in the blood, carbon dioxide in the blood, and hypoxia. That is decreased PO2. It's decreased PO2, not PaCO2. So this is decreased PO2. Let me correct it. So I'll save this PDF and share in the group. Okay. So they contain oxygen sensitive potassium channel. It's the exam question. So the channel they have oxygen sensitive potassium channel. Next question. Peripheral chemoreceptors are two types. They are carotid bodies and aortic bodies. They are at the bifurcation of common carotid artery, 9th nerve, and arc of aorta is 10th nerve. Arc of aorta is 10th. And they stimulate the respiration and correct the respiration. Now remember, H plus can't cross blood-brain barrier. H plus can't cross blood-brain barrier. H plus therefore in blood only stimulate the PC. H plus in CSF only stimulate the CC, but not both. Not both. Hypoxia act by PC, hypoxia act by PC. CO2 can cross blood-brain barrier and stimulate both PC and CC. How CC? By making H plus. So that means only carbon dioxide can act on both, and that's where the main stimulus for regulation of respiration, that is called as hypercapnic drive. So what is it called as? It is called as the hypercapnic drive. So what is hypercapnic drive? It is the concept of the these two factors controlling the respiration. Okay, chalo. So I'll just discuss chemoreceptors here. They correct respiration. So chemoreceptor correct the respiration. There are two types, CC, PC. PC are aortic and carotid bodies. 10th nerve, 9th nerve, stimulated by decreased PO2 and yes, increase H plus in blood. CC are stimulated by H plus in CSF. Fine. Paper will be always easy because you are studying now. You're watching my lecture. It will be easy. Now question, CO2 act on both PC and CC. That is why CO2 is the main regulation of, yeah, main stimulus regulation of respiration. So that is the, yes, in the CSF, sorry, in the CSF. Okay, so that is the story. Okay, chal. So we'll take a 5-minute break and then I'll continue with the CNS. Endocrine will cover in the, yes, so endo will cover in the medicine part. So I'll just take 5 minutes break. Same link will continue. Yes, study now. Okay, all question will come from this PDF, at least 10 MCQs. Okay, 5 minutes break, then I continue in 5 minutes. Okay, so start sharp at 8:25 p.m. Chal. So let's start. Let's join in. I'm here. Please come back. चलो let's start. चलो भाई, let's continue. Please join in. Let's continue. Okay. So we are doing the last system now. That is our CNS. Let's start now. Please join in. So we are studying the last system, CNS. Okay. So there are two type of cells in the CNS. One are the neurons, and the other are the glial cell. Okay. Now the neurons are the main cells. Okay, and they are doing all the activities. Okay, but after birth there are no neurons formed except the hippocampus. So that means they are like a stop end. Whereas glial cells are more in number and they can form all life like gliosis or glioma. Glioma are the most common brain tumor. So that is the glioma or the gliosis. Now, what are the types of glial cell? Microglia. Microglia are the macrophage. Mnemonic I made was microglia put the food in microwave, heat and eat. So what is for heating, eating the bacteria? Microglia is there. Okay, microglia. Is it okay now? Is the audio video okay? Check and tell me. I think it's okay from my end. Okay. Then comes the next question. Microglia, macrophages. They are basically phagocytes. Phagocytes. Then oligodendrocytes are basically, they make myelin in the CNS, but in the peripheral nervous system, Schwann cell make the myelin. So who make the myelin? Schwann cell make the myelin. Then ependymal cells are the lining cells of the ventricle. They cover our ventricular surface. Which cells? Ependymal cell. Then come the astrocytes. They are the supporting cells to the neurons. They also make the blood-brain barrier, also repair of the neurons. Repair and migration of neurons. So repair and migration of neurons. Let's see next. CSF, 150 ml is the volume. Daily production rate is 500 ml per day or 20 ml per hour is the rate of production. Secretion, secretion is choroid plexus and absorption is arachnoid villi. C is secretion, absorption is arachnoid villi. The normal pressure is 50 to 130 mm Hg H2O or 5 to 10 mm mercury. Next question. What are the function of the CSF? It gives nutrition, glucose, oxygen, amino acid, plus it remove the waste, like whatever toxic waste they are making, the neurons, plus it maintain temperature, pH, osmolality. It's like plasma, maintain everything, and shock absorber. So CSF is just like plasma, but it has a lower concentration of almost everything, especially glucose. Glucose is just 60%. What the glucose is? 60% in the CSF. What is more? Carbon dioxide, bicarbonate, magnesium, chloride, they are in higher concentration in the CSF. Now, let's see the part of the neurons. This is the cell body. This is a dendrite where synapses are formed. Can you see? This is the axon. This is axon hillock where AP is generated. So, where is AP made? Axon hillock. AP is made. Okay, AP made. Make action potential. Then these are Schwann cells, and between the Schwann cell we have the node of Ranvier. It is for conduction of the impulse. Okay, so the impulse is produced by axon hillock, then it travel from initial segment IS is initial segment, and then it travels and reach the axon terminal where it causes the release of neurotransmitter. So where is neurotransmitter release? It is released at the which area? It is released at the which area are you releasing it? It is released at our axon terminal. Done? Okay. Now Nissl granules in the cell body are actually free ribosomes. So they are what thing? They are free ribosomes. Okay, free ribosomes. And what they do? Protein synthesis. Now in case of neuronal injury, the first change is breakdown of Nissl granules. This is called as chromatolysis, and this change is called as Wallerian degeneration. So what is Wallerian degeneration? It's a breakdown of neuron after injury. Okay. Now RMP and AP. Understand? I'll just make it easy for you. Membrane is selectively permeable. At rest, it is permeable to potassium and chloride. So they are called as which ions? Diffusible ions, but not permeable to sodium, calcium, phosphate and proteins. So they are called as indiffusible ions. So that is why there is an uneven distribution of ions across cell membrane. This is called as Gibbs-Donan equilibrium. Some ions are more inside, some are more outside. So who is more inside? Potassium is more inside, phosphate, protein more inside. Sodium, calcium, chloride are more outside. So once again, where is sodium, calcium more? Outside. Chloride more? Outside. Potassium more? Inside. So that's why sodium will try to come inside. Go inside. So it will come inside and it will try to go out. So that's why sodium want to come in, potassium want to go out. Okay. So therefore it create electrical currents because of movement of ion. So where is sodium going? Inside the cell, calcium inside the cell, chloride inside the cell. So they try to come inside because they are more outside. Am I right? And potassium will try to go out. This create electrical potentials which are called as equilibrium potential. Okay, equilibrium potential. Okay, it is given by Nernst equation. No need to learn the equation. It is 61.5 log of concentration outside by inside. Now what are the EP value? So let's see. Sodium is plus 60, calcium is plus 100. Why? They are cations which are coming inside the cell. So they create a positive EP. So why they have positive EPs? Because they are coming inside the cell and they create plus plus plus. Whereas chloride is an anion, but when it comes inside the cell, it create a negative value. So why is it creating a negative value? Because it is coming where? It is coming inside our cell. So that's why it is putting the negative value. Are you clear? So putting a negative value. Whereas potassium is a cation plus, but it's going outside. So there's a loss of plus, so it create a negative EP. So let me summarize. What do sodium and calcium do? They have, first they come inside and create positive EP. So they create a positive EP. Okay, EP is equilibrium potential, equilibrium. Whereas chloride and potassium, they have negative EPs. Okay, why potassium is negative? Why? It is cation, it's plus ion. going outside. So that's why potassium create a negative EP. Chloride is already negative, it's already an ion, negative, and coming inside. That's why it is creating a negative value. So creating a negative value in this case. Am I clear now? Done? So is it clear to all of you? Okay. Now let's continue. Okay. What is the other concept here, right? At rest membrane potential is called as RMP. So what is it called as RMP? It depends on potassium and chloride, as cell membrane is not permeable to sodium, calcium, but permeable to potassium and chloride. So who will cause the RMP? Potassium and chloride. Why? Membrane is permeable. So sodium cannot come in, but potassium can go out. So that's why it creates the EP. So what is the EP dependent on? So remember, EP is dependent. So EP is due to we'll just discuss 1 second. So EP is because of which ions? Potassium and chloride. Why? Because they are permeable. Fine. And that's why RMP is always negative. So once again, what caused the negative RMP? It is your potassium and chloride ions. Are you clear? So they create which RMPs? Negative RMP always. So let's continue. Next question. What are the RMP values? Neurons minus 70, then skeletal cardiac muscle minus 90, smooth muscle, thyroid, SA node minus 50, RBC minus 12, rod and cones minus 30, hair cell cochlea minus 40. Hair cell cochlea minus 40. Okay. Now, if membrane become more negative, it is called as hyperpolarization. Hyperpolarization is more negative. If it become less negative, it is called as depolarization. Okay. So once again, what is more negative called as? So once again, RMP is always negative. Due to what? Why is it always negative? Due to, yes, potassium and chloride. If more negative, yeah, no need to remember the value. Just remember RMP of neuron is minus 70, muscle is minus 90, and smooth is minus 50. Just remember these three. Okay, Rami? Okay. If more negative, hyperpolarization. If less negative, depolarization. Okay. Now, depolarization can trigger action potential. What it can trigger? Can trigger action potentials if reach firing level minus 55. So when does AP start? AP started firing level. What open? Voltage gated sodium channel open. So once again, voltage gated sodium. Let's say this minus 55, the membrane will depolarize. Okay, and sodium come inside. causing big depolarization. Okay, big depolarization up to plus 35 millivolt called as pipe potential. So this is plus 35 pipe potential. Are you clear? This is depolation. Then the membrane will repolarize. This is by firing level. Okay, so this is the firing level, FL. So this D, this is D. Now what happens? Sodium channel close and potassium channel open, and that cause the membrane to return to RMP. So RMP is return to RMP. Due to potassium channel opening. So potassium channel open and the membrane return to the RMP. So it will return to the RMP. Okay. What open up? Potassium channel will open up. Yes. And potassium goes out. Done? Now let's continue. Now if the membrane is depolarized at synapse by neurotransmitter, it is also called as EPSP, which is excitatory post-synaptic potential. Excitatory post-synaptic. Just understand, RMP is a negative value. RMP of neuron is minus 70 millivolt. Are you clear? So if it become minus 60 or minus 50 or minus 65, they are less negative. This is called as depolarization. Are you clear? But if it become minus 80, minus 85, this is more negative. What is it called as? Hyper. Which last topic, Renita? I can't understand. If you're asking sodium, potassium, just remember sodium, calcium are plus ion, come inside the cell, create plus value. So that's why they are having plus values. Whereas potassium goes out and create the negative value. So just remember, potassium create negative by going out. Okay. Fine. Just remember that. Okay. Potassium negative go out. Okay. It's hyperpolarization. And D can trigger AP. D cause AP. Action. So what caused the AP? Depolarization. AP is nothing but depolarization and Re. Re is by potassium, D is by sodium. That's it. Khatam. So D is by sodium, Re is by potassium. Okay. Next question. If there is a depolarization at the synapse, it causes, yes, excitation. So called as EPSP. So what is the depolarization at synapse called as? At synapse, due to neurotransmitter is EPSP. It is called as EPSP. What is EPSP? Excitatory post synaptic potential. And IPSP. Clear? Chalo. Now let's see. When you open sodium channel, sodium come and cause depolarize or EPSP. Example, glutamate. So glutamate is the main excitatory neurotransmitter in the synapse. So who's the main excitatory? It is glutamate is the main excitatory neurotransmitter. In which area? In our, yes, in our synapse. Are you clear? And how does it act? It acts by opening sodium channel. Then if you open calcium channel, calcium will come inside and cause a depolarization, also called as EPSP. Example, substance P. Substance P stimulate the SG cell, which are substantia gelatinosa cell. So they are what cells? Substantia gelatinosa cell, SG cell, and they are the first neuron in the pain pathway. Once you excite the pain pathway, there is pain sensation. What is pain also called as? Pain is given one more name. It is called as what? Pain. So the pain is also called as what? Algia, algesia, dolor. So this is pain. So this is our which sensation? This is our pain sensation. Are you clear? So this is the pain sensation. Done. Next question. If you open potassium channel, potassium will go out, efflux, and that create negativity because of loss of plus. It causes the hyperpolarization or IPSP, or the IPSP is the case. IPSP. Example, morphine. Morphine cause pain relief. How it cause analgesia? Basically, it inhibit the SG cell via mu opioid receptor, and this causes the loss of pain. That is analgesia. Okay, morphine. Last is if you open chloride channel. If you open chloride channel, chloride will enter the cell. It causes a hyperpolarization or IPSP. Glycine in spinal cord, GABA in brain are the main inhibitory. So who's the main inhibitory in brain? Main inhibitory in the brain is your GABA. Okay, GABA. So let's summarize. Sodium channel and calcium channel, they depolarize and excite. Chloride and the potassium, they hyperpolarize and inhibit the neuron. They inhibit the neurons. Okay. Now, if you give a threshold stimulus of plus 15, it will make the membrane reach firing level, FL. FL is firing level, and create action potential. And AP follow all or none law. Like either it will come or not come. It's like pass or fail. Like in FMG exam, what is this? Either you are pass or fail. You cannot say I am 50% pass. So you are either pass or fail. So that is the concept of the AP. Okay. So clear? So this I discussed already, action, potential, and what help in the RMP and AP. Sodium potassium pump is the Nokia pump. It pump 3 sodium out and bring 2 potassium in. So that is why high sodium in the ECF and high potassium in ICF, and this help in RMP and AP. So what help in RMP and AP? It is your, yes, which thing? It is our sodium potassium pump. Okay. This I discussed already, action, potential, no need to discuss, ignore it. Now we'll discuss memory. So where is memory stored? So remember, when you read something again, it will cause the increase neurotransmitter and receptor. So what increases? Neurotransmitters okay, so neurotransmitters and receptors will be excited and causes, yes, increase in the memory. Yes, all will pass, don't worry. We are going to have perfect results. So those who are watching me, I am telling you, all will pass. Just keep studying, keep watching. If it was easy to pass the exam, all would have passed. But why only few people pass? Because not all have the same sincerity, dedication to sit and study. That's why what I have seen is, in school I had 50 students with me, okay, but only I became doctor out of that, and 2-3 become engineer, 2-3 rest were just working normal. I'm not saying they are, but I'm just saying ki, to be a doctor it's not easy. You have to work hard continuously, pass and get good marks in all the test, all the exam, 5th class, 6th class, 10th class, then board exam, 11, 12, then after 12 the entrance exam, then medical college, then now only then you become, okay. And remember, more you work hard, like if you make a food, I cook, let's say biryani for 5 minutes, it'll be a bad biryani, it'll be a very bad biryani. I need hours of preparation, then you get a good biryani. If you don't want to eat a raw uncooked biryani, why would anyone want to have a person successful? You yourself will abuse the person. Like a star kid get a movie role because his or her father was a film actor, you will say a nepotism. But again, if you are not working hard and you want success, you're doing the same thing. The same people you abuse, you want to become that. That is hypocrisy. Okay. So increased synapses cause increased memory formation, and increased memory formation is because of changes in the synapse. So this is called as synaptic plasticity. So what is plasticity? Increase in neurotransmitters. So what is plasticity is? It is increase in the neurotransmitter, which is called as the plasticity. Are you clear? So it is called as the plasticity. Okay, it helps in better recall and faster response. Now it is basically the best mechanism is long term potentiation. And who do this? It is by NMDA receptors. So if there is an increased NMDA receptor, it causes much better memory and recall. This is by hippocampus CA1 neurons. So which neurons? Hippocampus CA1 neurons. Yes. And they convert short-term memory into long-term memory. LTM is long-term memory. How do they convert short-term into long-term memory? The secret is they basically do what? They basically okay, yes, causing better memory recall. Okay. Now sensory system has three things. Receptor make the APs. So what make the AP? Receptor make the APs. Pathway carry the impulses to the cortex, that is called the sensory pathway. Then cortical centers, they are for perception, memory and all these things. Okay. So once again, who make the AP? Receptor. Who carry the information? Pathway. What are the cortical centers for? They are for perception and memory. What is perception? Sensation, understanding. Yeah, understanding of sensation. So I'll discuss. So perception is basically understanding of the sensation. So understand the sensation. Okay. Next question. The properties of receptors are as follows. Number one, threshold. What is threshold? Is the minimum amount of stimulus we need to give to a stimulus to the receptor to get the response. Like example, hearing occur 20 hertz or above. If you have a sound less than 20, you cannot hear it. Okay, cannot hear it. Next question, specificity. Okay, receptor respond mainly to their type of stimulus. Like example, light is the only stimulus for rods and cones. What are the only stimulus? Light is for, yes, rods and cones. Then come adaptation. What is adaptation? It's a decreased response on giving what? Constant stimulation is called as the adaptation. So what is adaptation? Decreased response on constant stimulation. Okay. Now example, rapidly adapting, touch, pressure, vibration are rapidly. So you don't feel after some time. Example, when you wear your clothes, you can feel your clothes. After some time you can't feel your clothes. Or you're wearing glasses, after some time you don't feel the glasses. Reason, receptors adapt. Okay. Slow adapting like position of proprioception, and non-adapting is pain. That is, you don't lose the pain sensation till healing occur. Then Weber, Fashner, or Stephen Power law. Stephen Power law. What does Stephen Power law say? So Stephen Power law, it say that if you give more stimulus, there is an increase in the intensity. Yeah, you don't feel the ring, that is called as, yes, adaptation. Okay. Or you don't feel the smell of a flower, or when you come to Gautam Nagar you feel the smell. After some time you don't feel the smell in Gautam Nagar. Why? Receptors have adapted. This is called as Weber Fashner's law. Now we start with first spatial sense, that is vision. So in vision, what are the receptors? Rods and cones. Optic pathway is there, which is optic nerve, chiasma. You can watch it in my ophtha revision. And then there are cortical center. So what are the cortical center? 17, 18, 19 in the occipital lobe. Color vision is by V4 area and color blebs in the occipital cortex. So what is color vision by? It is V4 area and color blebs, and the color blebs, they cause the, yes, what? Sensation of okay. Next question. Okay, now we discuss the, yes, mechanism. In dark rhodopsin, which have vitamin A, the dark is 11 cis retinaldehyde and plopsin chain. So when the light fall, it become all trans retinaldehyde. So what is dark having? Dark has cis, light become trans. So remember the mnemonic, light ta ta trans. So light make trans, light make trans. So what make the trans? Light will make our transform. Okay. One second. Chalo, okay, let's continue. So just getting the message. Yes. So in dark it is cis and light become trans. Okay. Now it lead to a closure of sodium channel, and by which protein? Transducin protein, and this lead to hyperpolarization. So just remember the word I am telling you, my golden word. First question. Dark. What is dark having? What is dark having? So dark has what? Dark has what? Tell me, what is dark having? 11 cis. Retinaldehyde. Okay, retinaldehyde. Okay, so it is retinaldehyde. Okay, then in light it become all trans retinaldehyde. Okay, then it lead to closed sodium channel. Close sodium channels via transducin G protein. So via transducin G protein. Okay. So are you clear? So it is your transducin, which is the G protein. So transducin G protein. Clear? And that cause hyperpolarization. Hyperpolarization. Now we discuss the auditory system. So in auditory system, there are inner hair cell in the organ of cochlea. They basically have potassium channel. These potassium channel opener cause what? Cochlear microphonic potential. So what they produce? Cochlear microphonic potential. So CMP is what? Cochlear microphonic potentials. Clear? Next question. We have the auditory pathway, that is colima. What is colima full form? Anyone? What is colima full form? Anyone? Next question. In auditory cortex, what is the area? Area 41 and 42. Superior temporal gyrus. Area 22 is vernix area. It is for language and what? Comprehension of the speech. So that is the case. So language and comprehension of the speech. Okay. Angular gyrus area 39 is for word memory. So what is it for? It is for our word memory. Are you clear? So it is for the word memory. Are you clear? Word memory. Let's revise it. So understand. What is cochlea contain? Cochlea. Yes, cochlea contain, yes, inner hair cell. Inner hair cell. What do inner hair cell do? So okay, so inner hair cell, organ of Corti. Are you clear? Yeah, you're right. You're right. It is cochlear nerve, olivary nucleus, lateral lemniscus, inferior colliculus, medial genital body, and organ of the auditory cortex. Very good, Heba. Heba, very, very good. Okay. Now they have inner hair cell, potassium channel open, and potassium from endolymph. Which chamber? Scala media, not sala. It is scala media. So scala media is there. It causes our currents called as CMP currents. What is CMP? cochlear microphonic potential. So CMP is cochlear, and later they become action potentials, APs. So are you clear? Yes, Payal, you are right. It is cochlear nerve, olivary nucleus, lateral, lemniscus, inferior colliculus, then it is medial genicular body and auditory cortex. Okay, very, very good. Perfect, perfect. So clear? Next is, what else do we also see or discuss? Right? Okay. Yes. The taste. So taste, आओ स्वाद की बात करते हैं, स्वाद. So remember, स्वाद के लिए जो एरिया है वो कौन सा लिख लो? कॉर्टिकल एरिया फॉर टेस्ट, वो है इंसुला. स्वाद इज इंसुलर कॉर्टेक्स. तो कैसे याद करेंगे? तो कैसे याद करेंगे? आओ याद कराता हूं. देखो, स्वाद, इंसुला, स्वाद. व्हाट इज इंसुला? इज स्वाद. ठीक है. One second, okay. Next question. Now remember, okay, inner hair cell, remember, inner hair cell contain what? Organ of Corti. Okay, clear? Potassium channel will open. As potassium channel open, potassium from endolymph, that is kala media, will, yes, create CMP. What is CMP? Cochlear microphonic potential. Then it cause action potential, that is APs. That cause the action potentials or APs. Action potential और APs. Okay, सही है, शाबाश. तो ये इनर हेयर सेल ऐसा लगता है. ये इस पे हेयर सेल पे स्टीरियो सीलिया है. Are you clear? So these are the stereo cilia. Okay, stereo cilia. Done? चल. So taste पे क्या होता है? टंग में होती है papilla. So what is there in the tongue? There is papilla. The papilla in the tongue are basically having which all? Yeah, insula is for taste. स्वाद, स्वाद. कुछ नहीं हुआ. Actually, I just got message regarding the class and scheduling, so I'm just replying. So yes, test will have the class of medicine very soon. Don't worry. So we are planning everything. Okay, चलो. Now fungiform papilla. Okay. So fungiform papilla is a tip. Remember, fun कहाँ होता है? Tip पे. So fun is in the tip. Foliate is like a leaf. Foliate is like a leaf. Foliate. ये कहाँ होता है? Sides पे. और circumvallate, late is at the back. Late is at the back. Okay. और back पे bitter भी होता है. तो याद करना, back benchers are bitter people. They're always bitter. Why? We are sitting at the back, we can't do. So back benchers are bitter. Back benchers are bitter. Okay. Chal. Now salty is by sodium and potassium. So what is the salty sensation? It is sodium and potassium. Sour or sour is basically H plus or acid. H plus or acid. Okay. Sweet is by G protein couple receptor. Cyclic AMP is the second messenger. It bind the sugar. So what it bind? Bind sugar. So it bind sugar and cause the, so bind sugar. So it bind sugar and cause the sweet sensation. Clear? Next question. Bitter is again G protein couple, but it bind poisons, also drugs like quinine. So drugs like quinine. So what drugs? Like quinine. Next question. What else apart from drugs like quinine? Also they are responsible for, yes, alkaloids. This was INICET exam question. They all cause bitter sensation. Now new taste we have discovered is umami. Umami. Pata nahi kiski umami? Umami. So umami is by monosodium glutamate. So what is umami by? Monosodium glutamate. It is present in Ajinomoto salt. So Chinese and Japanese food, they are very tasty. Why they are very? Because umami is a very addictive sensation. And it is released by protein, amino acid, meat, momo. So why momo is so addictive? Why people love to eat momos a lot? Because it is having protein, amino acid, meat, etc. So they all are having this. Okay. Now misconception. Chili is not taste but pain sensation. Okay. So if someone say I love pain, I love chili. So you should say no. It's not a taste. It's a pain sensation. That means technically you love pain. That make you a sadomasochist. Why? Because you're loving the pain and you're eating, that is you're giving the pain. So you're a sadomasochist. So a person who eats chili is a sadomasochist. Second, chili sensation is pain sensation, and pain is felt in the mouth or other areas also. Other area. So where can you feel the chili sensation? Yes, we can feel it in the mouth, nose, ear. Or if you eat too much chili in the night, next day morning also you can feel the chili sensation. So once a Indian was talking to a foreigner and the foreigner was making fun of Indian. Ki why you Indian use water in the toilet to clean your bum? It's very dirty. Water cause all infection, orophycal, dirty people. Why don't you use tissue paper like us? Use tissue paper, wipe clean, no dirt. So Indian said, eat Indian food. Your tissue paper will catch fire. And when there is fire, we should put water, not tissue paper. Gadhe, पानी डालोगे तो इसलिए भी इंडियन eat chili in the night and next day use water to bring the fire down. तो रात को मिर्ची खाता, दिन में पानी से धो देता. That is what Indians do. Okay. Next question. Chili is containing the receptor called as capsaicin. So what is that receptor is? Capsaicin. Okay. And it bind vanilloid receptor. So what it bind? It bind vanilloid receptor, also called as VR or TRPV4. So vanilloid is VR or TRPV4. Okay. So this is the question. Tip is for sweet. Tip is for sweet. Back. Bitter is back. Where velvet is present, it's not tat. Then salty is sides. Sour is back. Umami. Who's in the middle? Ma. Ma is umami. Ma is umami. So where is sweet? It is tip. Side is salty sour. Middle is umami. Chalo. Let's see. SSS. So what is SSS? It is somatosensory system. So what is SSS? It is somatosensory system. Okay. And it is basically sensations coming from the body. Okay. Like pain, temperature, pressure, touch. Okay. It has receptors in the skin, joint, muscle, etc. Epidermis, only one receptor called as Merkel disc. If you've seen my derma revision class, I discussed that epidermis contain Merkel cell which are for touch. So they cause 2-point touch, like 2 point. So that's why they help the blind people. How do blind people read? Not by seeing, they read by touching. So what make them touch? 2-point discrimination, is the case. Okay, they are best at fingertips and the lips. So where is the best 2-point discrimination? Fingertip and the lips. Don't worry. And help blind read braille script. Or the distance they can work 1 to 2 millimeter. Then rest all are in dermis. So rest all receptors are in dermis. Example, Meissner corpuscles. They are for 2-point discrimination, fine touch and low frequency vibration. So Meissner is low frequency vibration. Pacinian in deep dermis is onion shape. Pacinian sound like onion. Pacinian, onion. So what is onion shape? Pacinian. And it is for pressure and high frequency vibration. So who's for low frequency? Which corpuscle is for low frequency? Meissner. What is for high frequency? It is your Pacinian. So Pacinian is for high frequency. Low frequencies, yes, is. Now comes Ruffini endings and cross and bulb. Ruffini is for rub, garam, garam, rum. Rum piyo, garam ho jao, warm. And what is cross? Cross is for cold. Cross, ka cross, ka cold. So cross is cold. Cross is cold. Okay. So clear? Yes. It is cross. Now let's revise it. आप बताना, मैं पूछता हूं. आ जाओ. Let's see all of you give the answers. Okay. So what is for touch? Ma or ma. What is for pressure? Pacinian. Easy. What is for cold? Yeah, it is both, but Merkel better. Okay, Renita? Merkel is better for 2-point discrimination. Cold is cross. And what is for warm? Warm is our Ruffini. So warm is Ruffini. Are you clear? So warm is Ruffini. Done? Okay. Now, this is for 2-point discrimination. This is for low frequency vibration also. Pacinian is for Meissner's. It is Merkel. It is Merkel. Okay, it is Meissner. Low frequency vibration. It is high frequency vibration. Done? So high frequency vibration. Chalo. Now free nerve endings are for pain, temperature, itching and sexual sensation. Pain, temperature, itching and sexual sensation. Pain is of 2 types, fast pain and slow pain. Fast is carried by what? It is by A delta fiber and the A delta myelin fiber, and they are by skin injury. And slow is C unmyelinated autonomic nerve fiber. Example, angina, renal colic, biliary colic, headache, muscle ache. It is also called as deep visceral pain. It is called as superficial or somatic pain. Okay, it is sharp and well localized. So if cut is there, you know where is the cut. That is why it is sharp and well localized. Whereas in the case of internal pain, you don't know where the pain is. Like if there's a emboli in the coronary artery, there's a MI or angina, you don't know where the exact pain, you say just left side. So that's why it is dull and diffuse, Then it can refer or radiate to different side. Example, testes is a intra-abdominal organ. After birth, testes डोंट लाइक द एब्डोमेन, क्या बोलती है, ओ बहुत ज्यादा गर्मी है, मजा नहीं आ रहा, लेट्स गो टू सम कोल्ड एरिया, स्टेज इज मच बिलो, एंड नाउ व्हाट हैपन, अ पर्सन इज प्लेइंग क्रिकेट विदाउट एनी प्रोडक्शन एंड अ हाई स्पीड बॉल कम एंड बूम, उसका समझ लो अखरोट टूट गया एंड उसका नट्स पे ऐसा लगा, एंड नाउ देयर इज अ सिवियर पेन, बट दिस पेन इज फेल्ट एट umbilicus T10. Why? Because the nerve is still connected to T10, and that is why he is wondering कि you press the doorbell at the ground floor and the door open at top floor, ऐसा कैसे हो गया, इसे कहते हैं रेफर्ड पेन, क्या बोलते हैं इसको, रेफर्ड पेन. Next question, how many ascending pathways are there? So there are 3 ascending pathway. What are they? In the white matter, first is dorsal column, it carry all the sensation except pain and temperature. Who carry pain and temperature? Lateral. So the mnemonic I made, lateral. If you kick someone, लात मारा तो दर्द होगा, lateral is लात मारा तो दर्द होगा, so pain and temperature. Ant, mnemonic is ant, ant. What is ant? Ant is an insect, and if a ant is crawling on your skin, it causes itching. So itching, chi, so chi, itching. So itching is caused by ant. Itching is caused by ant. Ant itching, chi. Okay, and also crude, touch and pressure. So who carry crude? तो याद करना, crude ant. Mnemonic is crude. Ant is a very crude animal. Doesn't listen. Keep running here and there. Crude. So that's why rude, crude. Okay, rude and crude is the mnemonic. Am I clear now? Chalo. Next is what else do we also see, discuss or have? So right? Yes. So who will carry fine touch? Dorsal column. Stereognosis, dorsal column. Graphesthesia, dorsal column. Pressure, pressure. 2-point discrimination. Proprioception, all are by stereognosis, all by dorsal column. So who carry yeah, you can watch my medicine RR, it will be very good for your exam preparation. Okay, next question, in the brain there are 4 lobes. The frontal lobe is in front of the sulcus, then behind is postcentral gyrus. Postcentral gyrus is this one, this is your precentral gyrus. Okay, and this is the occipital lobe, this is the temporal lobe. So 4 lobes are there. The postcentral gyrus is our sensory cortex. So this is sensory cortex, and this is premotor, it is motor cortex. And you hit 4 and 6, area 4 and 6. So area 4 and 6, chokka, chakka, 4 and 6. Okay. Next question. The precentral has 2 parts, primary and secondary. Primary is area 312, secondary is area 5 and 7. So once again, what is primary? It is area 312. What is secondary? It is area 5 and 7. 5 and 7. So once again, primary area 1 2 3 1 2, secondary 5 and 7, and 4 6 is motor. So remember, 1 2 3 sensory, 4 6 motor, 5 6 sensory. Okay, and maximum area, remember maximum sensory area is for face and hand. Face and hand. Okay, maximum area is face and the hand. Okay, face is you can say, so the highest area, so maximum area in the cortex is face and the hand. Okay, and in face, thumb. So I'll write here. In face, lips, and in hand, It is thumb. Are you clear? So is it clear to you? Now comes the question. Motor cortex contain bed cell, which are pyramidal. They are upper motor, so they are UMN. That is upper motor neurons. So upper motor neuron, they give a tract called as corticospinal or pyramidal tract. So corticospinal or pyramidal tract, and the fibers will cross at the lower end of medulla pyramids. That is why they are given one more name, also called as pyramidal tract. So the other name, that is why they are called as pyramidal tract. So they are called as a pyramidal tract, PT. So they are pyramidal tract, okay, pyramidal tract, PT. Second question, they do voluntary fine scale movement and also control reflexes. Now they stimulate the alpha motor neuron in the anterior horn of spinal cord, and what they do? Cause all the contraction. So who give all the contraction? It is your alpha motor neuron, release ACH and cause contraction via calcium from ryanodine receptor. Ryanodine receptor. So what receptors? Ryanodine receptor. Now upper motor neuron, what are they? They control the element via tract. What tract? EPT and the PT. EPT and the PT. So that is why if there is a upper motor neuron lesion like a tract lesion, example stroke, I'll discuss them in medicine class, don't worry. Like a stroke, there is spastic paralysis, increased tone, increased reflex. If there is an element controls the muscle via motor nerve. So nerve lesion is UMN or element lesion. So it is a element lesion. It causes flaccid paralysis, decreased tone and decreased reflexes. So upper motor spastic paralysis, lower motor flaccid paralysis. Right now just remember this much. That is tract injury. There is flaccid paralysis. Why? I'll discuss this in medicine. Flaccid paralysis, okay. Whereas element lesion is nerve injury. Yes, there is. Oh, sorry. It is flaccid here, spastic here. So by mistake I wrote, okay. So spastic paralysis and the flaccid paralysis, okay. Done. Now muscle length is sensed by spindle. So remember the mnemonic, length is spindle. Le. So remember, length is spindle, and tension, tendon, ton. So tension is tendon. Muscle spindle cause a reflex called as stretch reflex. So the reflex called as stretch reflex. What is that also called as? Deep tendon reflex, like knee jerk. So when you strike the tendon, the muscle contract. How? Increase length by stretching of the muscle will stimulate the muscle spindle. So what it will stimulate? The muscle spindle. The muscle spindle will then activate the intrafusal muscle fiber. This will then activate the alpha motor neuron, which contract the muscle to decrease length back to the normal. So very simple. Increased length by stretch causes contraction of muscle, so the length decrease back. Negative feedback. So it's a negative feedback mechanism. So what is it? It's a negative feedback for length. So negative feedback. Now, second question, there are gamma motor neuron. What they do? They stimulate intrafusal fiber and cause the continuous muscle contraction called as the muscle tone. So one line summary, what causes muscle tone? So muscle tone is caused by our what thing? It is caused by gamma motor neuron. So what causes the muscle tone? Gamma motor neuron. Okay. So length is sensed by spindle, tension by tendon organ. What is the tendon organ do? Tension. Length is spindle. Okay. Last question. Basal ganglia is for planning and movement. So what is it for? Planning and movement is done by basal ganglia. Cerebellum is for coordination and correction of the movement. So I will cover these things in medicine. So don't worry at all. Just remember they are covered in medicine. Now, where are emotions produced by? So they're produced by limbic system. So produced by which area? Limbic system. Temporal lobe, it controls the emotion. Thinking is by frontal lobe. So what is thinking by? Frontal lobe. So thinking is by frontal lobe. Next question. Pleasure is given by dopamine from ventral tegmentum. That's why it is the pleasure or reward center. Which center? Addiction or reward center. Motivation mood is uplifted by serotonin 5-HT from dorsal raphe nucleus. Decreased serotonin causes depression. Causes the depression. Okay. Lastly, just write hypothalamus here. Okay. So what are the features or findings of the hypothalamus? Okay. So I don't. Hypothalamus, HT. So first remember hunger center, lateral nucleus and stimulated by orexin, ghrelin, NPY and AGRP. Good thing they will not ask you any details, just names are sufficient. Okay. Then comes satiety center. It is ventromedial nucleus. Ventromedial nucleus. Okay. It is stimulated by leptin, alpha MSH, insulin, etc. Then circadian rhythm. Suprachiasmatic nucleus. Suprachiasmatic nucleus. Suprachiasmatic nucleus. And dark. In dark, pineal gland, melatonin, sleep induction. That's why we sleep better in the dark. Number 4, third center. Third center is lateral preoptic. Lateral preoptic nucleus. Okay. So lateral preoptic is our, yes, third center. Okay. So it is the third center. And the lateral preoptic, which is the third center, stimulated by SF4. Decrease volume and increase sodium. So SF4, low sodium, high sodium and decrease. Fifth, cold adaptation. In winter by posterior hypothalamus. How? Increase BMR, T3, T4, T3, T4, then skin vasoconstriction, piloerection and shivering, and non-shivering thermogenesis in newborn brown fat. It is absent in adults. So where is brown fat absent? Adults. Number 6, last one. Last is the heat adaptation. In summer by anterior hypothalamus. And it causes first change. Skin vasodilation and increase sweating. Increase sweating. And remember, sweating absent in newborn and heat stroke. So it's a very commonly asked exam question, asked in NEET PG. Yes, heat stroke, the sweating is absent. What is absent? Sweating is absent in the heat stroke. Okay. So I will upload this final corrected PDF with all the changes for you for the exams. This is our NLC. We cover everything. We have chanting, revision, Q bank is there. We have everything available. So you can contact us. It is all there in Delhi, Hyderabad and multiple. Fine. So this is our NLC center. So I am saving this PDF. Thank you very much all for watching. Those who are watching, it's my promise, you all are going to pass the exam. Those who are watching this PDF, studying with me, they will be able to clear. See, okay, leptin I explain, let me just save it first. First, leptin is an anti-obesity hormone which comes from our adipose tissue. Make leptin. So adipose tissue make leptin, yes, and it is basically inhibit the hunger, cause weight loss. Thank you very much. And that's why it is preventing obesity. So that is leptin. Okay. Chalo. Welcome to everyone. Best of luck. Tomorrow we'll meet. Yeah, I'm working hard. If I can work hard, why can't you people work hard? Yeah? You are younger than me, okay? You are younger than me, at least 10 years younger than me. Some might be even 12, 13 years. If you're younger than me, you should show energy, na? I'm taking class 10 a.m. to 10 p.m. 12 hours I can take classes. Why can't you people study this much? If I can work 12 hours plus, I'll make night MCQs. I will go for recording now. I have a recording. I'm going for my app recording till 2 a.m. So I'm going to do app recording. Why can't you people study this much? Okay. So please, please, please. Yeah. This is more than sufficient. Yes. No need to do anything. I have covered the main notes in RR itself. No need to do anything at all. Are you clear? So I will now post this PDF in the main group. You can come and join it. So let me just join you. So please Physiology. So please download. Medicine class timing, I think they are evening. Okay, tomorrow there is just a discussion of question. I think around 7:30. So tomorrow 7:30. Okay, 7:30. Medicine is evening. We'll update the schedule very soon. I'll have to check. Okay, chalo. Thank you, Pasiba Balshoi, Fazal Usta, Spokojnoči. Yes. Давай, до свидания. Take care, bye bye.